Okay, broadcast is live, I think.
Boleh proceed.
Live, okay. Assalamualaikum warahmatullahi wabarakatuh and good evening. Welcome everyone. Thank you for joining us for today's webinar. My name is Dr. Amran Mazudin bin Nama Fuad. I'm currently medical officer in Hospital Sultanah Nur Zahirah as a MO otolaryngology. So today we are gonna presenting entitled Road to ENT Surgeon by our two very honorable panelists. We are going to feature husband and wife duo, which are the esteemed panelists graduated from UKM Master Program. So the first panelist, looking in white, a great dress, very well, Mr. Nick Muhammad Hazli bin Nick Hussein. Overall about his background, he is undergraduate from the University of Liverpool in 2006, and so subsequently pursued his training in surgeon and lecturer at the Faculty of Medicine UITM, with an interest pursuing in subspecialty in otology. So he had got some very excellent award for him, and then some of the award is he have the Journal of the Laryngology and Otology, and have received best prize for the original article in May 2013, and then first prize for the poster presentation and competition, and then some of it is best group of proposal presentation in Minggu Penyelidikan Perubatan Kesihatan PPK in September 2013. That's already a long list for me to explain all the achievement for him. So, but the interesting for him is he got some very unusual hobby. I think very unique maybe for the head and surgeon, which he is a self-taught guitarist, and also a drummer as well. So he's got some love in sport, and for is actively doing some marathon and triathlon. So that's all for the first panelist, and then we proceed to the second panelist, which is his dearest wife. The name is Miss Sharifah Intan Safwa Shahabuddin Said Ahmad Fauzi. So she is basically graduated from the NUI PNC in 2009. Subsequently, proceed with his housemanship training program in Hospital Selayang for 2 years in 2009 till 2011. And then got pursued in MO-ship program in ENT in Hospital Semenjaya from 2011 and 2013, and subsequently get into the master program in HUKM 2015 and 2019, and his currently is working as a specialist ENT in Queen Elizabeth. So without further ado, I invited the first audience, Miss Intan Safwa Shahabuddin bin Said Ahmad Fauzi, to give her talk. So Miss Intan, the floor is yours. You can start.
Thanks for the introduction, Dr. Muiz. Hi, my name is Sharifah Intan, and I'm currently working in Queen Elizabeth in Kota Kinabalu, Sabah. So today I'm giving a talk on the career pathway for ENT in the under KKM government sector. Okay, next. Okay, so a few questions. I'm not sure if there are ENT medical officers or if you've just finished housemanship or a medical student, but how do you get into the program? And when you what will you, and after the program, what else can you explore after that? Next. Okay, so how do you get into the program? You can apply for this Hadiah Latihan Persekutuan, HLP, and this is the website that you can apply for. Okay, so when you open you'll get this page. Next. You'll get this page, and then you can pick Tawaran B, which is Sarjana Perubatan, and fill in all the forms. And when you fill in all the forms, there will be certain criteria like SKT and qualifications, and also your working experience. Next. Okay, so when you fill in all the forms, these forms go to the government level, K2M, and once there's two tapisan. So the first one, once you're approved for the first one, then they will contact you, and then they will put you in the second round. And if you pass the second round, then you'll be called for interview and for the entrance exam. I'll go in later more on what you need. The entrance exam, currently it's an MCQ format, which has 30 questions with 5 stems. That means for one question, there's A, B, C, D, E, and you can pick true or false, and it comes with negative marking. Negative marking means in that one question with 5 stems, if you get one right, you get 1 mark. One wrong, you minus 1 mark. But if you get all that wrong, then it's 0. So the majority of the questions are basic ENT knowledge, but there are some questions of principles of surgery and physiology as well, your basic stuff that we learned when we were in medical school. The paper set by university hosting the interviews, which is the 3 universities that which is UKM, UM, and also USM in Kelantan. And the entrance exam is really important. That's why I put it first, because it carries a big part of the selection process during the whole entrance exam and interview. Okay, next. So there is a that was the way that I had gone through, but there might be a new format for the exams. They call it MEDEX, Medical Specialist Pre-Entrance Exam.
So and this one gonna be implemented in the next exam. This one, the MEDEX exam.
Yeah. So for the other specialties, they are already implementing it for other specialties. But for ENT, so far they have not done it. But I heard that it might be compulsory starting from next year. But they will update you. So generally, this is So the all specialties pre-entrance exam is on this website. So you can pick which specialty that you want, and I've included the link here. And next. So this pre-entrance exam is a paper-based test, costs 800 ringgit, and it doesn't matter like which current department you're in, meaning which specialty. So if you're in general surgery and you want to take ENT, for example, you can do that, and you can take more than one specialty exam at the same time. So you can sit like 1 to 8 different specialty exams, and whichever one you pass, and if you've already applied for HLP for that program, then you can be eligible to be called for an interview. Okay, so next, and this is so. Next. Okay, so the big question, the interview, right? So the criteria during the interview is your experience as a medical officer of 2 or more years, and if you served in Borneo, which is Sabah Sarawak, or any area of pendalaman, publications, if you've sent any papers or any case, anything, even a poster presentation, then you have proof of that. If you have MRCS or Part 1 and 2 with the complete MRCS, that is it's considered during the interview, but it doesn't mean that you can bypass the Part 1, which I'll talk about later. Okay, you know how we have our service record? So you've heard of this thing called tindakan tata tertib. That means if you've had any disciplinary issues in your career, and it will be stated in your service book. It doesn't mean that if you have this tata tertib that they won't accept you. It's just that you'll be slightly lower down. So, and also they even look at SPM results, especially Bahasa Malaysia and Science. So that is a requirement as well. And I think if you have studied abroad, then you might need to just take these 2 papers. Okay, next. Okay. Other things they look at is experience working in a surgical specialty. So if you're planning to apply for ENT, it doesn't mean that you need to be in ENT department at the moment. So because there have been other candidates who have never had ENT experience, but they were program. So you could be in general surgery or urology, but any surgical specialty. But during the interview, they do ask basic ENT scenarios, like how do you manage stridor, what do you do, and post-tonsillectomy bleeding. Okay, so they do expect you to know a little bit about that. So a bit of reading before the interviews and exam is required. Logbook. So the logbook is good to start the moment, you can even start it if you're in housemanship, or you can start it as a medical officer, or if you since your whole career in ENT, it's good to start a logbook to list all the surgeries that you've ever done, so that and then you categorize it. So for example, they ask you like how well versed are you with tracheostomy, then you can say, oh, for the span of 2 years and 50. So they can roughly gauge how experienced you are. And whatever you write in the logbook, be prepared to answer any questions on surgical steps, procedures, and also possible complications. Next. Okay, so what is this?
Sorry, Intan, can I just interject a bit? Can you go back to the last slide, please? Right. Even though I'm not from KKM, I just want to add a bit, because I've spoken to a few of the KKM consultants who actually interview for this master's program. And basically the biggest weightage for the whole process is the MCQs and the Viva, actually. So the Viva has a huge part weightage on the scores that you eventually get at the end of the interview and the MCQ. So yeah,
the Viva and MCQ will contribute a lot of marks.
Correct. Yeah. And the Viva, they don't tend to ask things that are rare. Okay, so basically just want to gauge on how your clinical experience is with in ENT lah, and whether you are able to manage and whether you've seen enough patients, enough cases, so they'll be able to judge from your ability to answer the Viva. Also, with regards to logbook, it's very important to put a summary page at the start, so it's easy for them to have a broad overview of what kind of cases you've done in numbers, and then they can flick through for more details lah. Additionally, with regards to service, other than Sabah, having worked in Sabah and Sarawak, also seniority plays another has a lot of weightage as well in terms of your marks as well. I think those are the main ones that from what I've spoken to the interviewers from KKM. Okay, thanks. Sorry to interject.
It's okay. Next. Okay, it's a 4-year program, but obviously if you don't finish it in 4 years, there is a maximum limit of 7 years. So the current system is, they call it system bersepadu, which is a closed system. The bond to the government is 7 years, because this is different from the offers that was during our time and previously. So some candidates will be fully in the university. That's what in-campus means. So the 4 years you'll be in whichever university that was chosen for you, and some candidates will be 2 years in a KKM hospital and 2 years in the university. So in terms of service years for bond, so you have to. The bond is 7 years. So once you start working, you have to work for 7 years under the government. But if you were previously a JPA scholar for undergraduate, for example, you still need to add on to your JPA scholarships. So that's a bit of the bond. Okay, so previously the 2 years that you work in a KKM hospital is still counted, but now it's not. Also, as previously we could choose which university that we had preference for, but now that's not being done anymore. So they choose for you. Okay, next. Right, so just now I was saying about the logbook. You should bring a logbook for you should divide it according to different specialties, like head and neck, otology, rhinology, if you can, and then have a summary for each subspecialty, and you bring that during your interview. So your interview, you should bring your CV, which states your undergraduate degree comes from where, and your work experience. So they want to know housemanship, where were you working, and as a medical officer, were you in ENT immediately, or were you in another surgical specialty before that? So they want to get to know you that way. If you have, okay, so then you have also case write-ups. You have case write-ups to do during the 4 years. So there's, you have your requirements of 8 case write-ups, but it changes every year. So when you get in the program, then you'll need to do that. You do need to you do need publications for masters. So it depends on which university that you're stationed at. They have their own rules for scopus or other such requirements. And then in your final year, we have this year called registrar year. So you rotate in subspecialties on different teams. So for the first 3 years, you're under a general ENT kind of pool. And then after that, you rotate for whatever subspecialty that's offered by that university to get a more in-depth knowledge on each subspecialty to prepare you for becoming a general ENT specialist. And also you have a thesis in the 4th year, and the thesis will start earlier on, like all your data collection and all that, but you present your thesis in the 4th year, which is 6 months before your final exam, which is your part 2. And only if you pass your thesis presentation, your thesis defense, if you pass that, then you'll be allowed to sit for the part 2 exam. So these are the requirements. Next. Okay, talking about the exams, right? So there's two major exams. One's in the 1st year, they call it part 1, and one is which is called part 2. So the part 1 exam is for 2 days.
Sorry for interrupting, Sintan. I just asking. So this one included in which year exactly? For this one,
This is
part
the
1
first
exam.
Part 1 exam
year.
is in the 1st year is after 1 year, so it's at the end of the 1st year.
Yeah.
Okay, so there's 4 main topics, which is anatomy, physiology, principles of surgery, and pathology. So you have this MCQ, which they call it one best answer or single best answer, and it's 60 questions, and there's 2 papers. 2 papers. I think the anatomy and physiology is 1 paper, principles of surgery and pathology is a 2nd paper. But because it's one best answer, there's no negative marking. And this is different from previously. Okay, and then the 2nd day you have OSCEs, which is 11 stations, which is 10 minutes for each station, and you must pass each station. So microbiology is 1 station. So the rest of the stations, there's 2 stations each. So you need to pass the average of both the stations, okay, for each topic. And at the end of the 2 days, then you'll get your results immediately after that. Previously, if you have MRCS Part A and B, like the complete MRCS or DONS, you are exempted from Part 1. But however, at the moment, I think only UM is still practicing that. So for UKM and USM candidates, even if you have the full MRCS, you must still sit for Part 1. Okay. I think part attempts is around 3 to 4 times for average for all the universities. So you resit it every 6 months. Okay, next. Okay, so the 2nd exam, part 2 exam, that's in your 4th year, the final one, at the end of your 4th year. It's consists of 4 days. So the first day you have theory exam, consists of MCQs, which is 60 questions, 5 stems for each question. So that's 300 questions in total. And it's true-false format with negative marking. It's around less than 2 hours, 1 hour, 45 minutes. And like I said before, it's for 1 question has 5 stems. So it's 1 right, 1 mark, 1 wrong, minus 1 mark. Okay. And you have the written exam, which is on the same day. Duration is 3 hours. So you have this thing called short notes, and you have another one you have essays as well. So you have 3 hours to complete all that. And you get your results at the end of the 2nd day. I think on the following day you get your results. And if you pass the theory, only you are qualified to sit for the clinical part. And there will be a gap of 1 to 2 weeks between the theory exam and the clinical exam. Okay, next. So talking about the clinical exams. Clinical exams will last for 3 days. And at the moment, previously it's a conjoined exam. So that means all the candidates from all 3 universities will sit for the exam together. That's for each exam, for each year. So 1 year will be UM, another year will be UKM, and so on. But at the moment, for COVID protocols and for safety, they have segregated exams. So each university will run their own exam for clinicals. Okay, so you have long case. Long case, they give you 20 to 30 minutes to clock a real patient with his real problem. So you have full clocking and full examination. And then once you're done, you organize your thoughts, and then you have 20 minutes with 3 to 4 examiners with observers who will each take turns to question you on that case and any relevant information or finding after that. Okay, if you fail the long case, then you fail the whole thing. So short case is 4 stations. You have 7 minutes each, 3 examiners with observers, and it's divided into 4 stations, which is the subdivision of the subspecialty: oncology, rhinology, head, neck, and laryngology. And then the third one is Viva, which is 2 rooms, 20 minutes each, and they just divide all the subspecialty into 2 rooms, right? So, like I said before, the program, it lasts for 4 years, but you have a maximum of 7 years. So you need to complete everything within 7 years, the total. Okay, next. Right, so after you pass your exams and everything, then you have a period of gazettement, which is for 6 months, and this you can be sent anywhere in Malaysia for as long as they have that facility available there. And then after 2 years of work experience, then you can apply national specialist registry. So you still need to keep a logbook even after that. So at the moment, for me, I finished gazettement 6 months ago, and so I was sent to Kota Kinabalu. So I'm working there in Queen now. And I think I just finished my first year after I finished my exam. My exams was last year, end of last year. So you can get sent anywhere. Okay, next. Right, so my experience. I was an ENT MO after I was, when I finished housemanship. So I had about 4 years of experience before I got into the program. A lot of other candidates had more experience, some had less. So it depends. And you learn, I learned the basics. I learned the basics of ENT from from specialists and also from senior medical officers. But a lot of ENT experience, we need a lot of experience in surgeries as well as all the emergency cases when we're on call. But for experience in surgeries, I always look for cases from the clinic, and I follow up the patients myself so that you know when it's indicated surgical intervention and when it's not. So if it is, then you learn to recognize that, and then you can, when you follow up the patient, then you can even discuss with the specialist, and then you can request to operate on that patient yourself. So if you do that, most specialists will never say no, because it's a lot of initiative. And then, so I always, and also when I see patients in the clinic, I always make sure that don't just, continue safe. So we try to find, like, if there's a reason that the patient keeps coming to the clinic for like the past 4 years, there must be something else or maybe there's another way that we can help the patient. And also, everyone makes mistakes. So as long as you learn from your mistakes and you know when to call for help, it's okay. As long as you know how to fix it and you can call for help when it's needed. Next. All right, so tips to succeed. Not that I'm very successful, but I will give you some tips. Getting into the program is very competitive. Okay, so don't give up. For me, I applied twice. So the first time I went for the interview, I didn't get in, so I just applied the following year. So it's okay if you don't get it in. If you don't get in, if your friends got in but you didn't, it's okay. Just keep trying. But every time you keep trying, add something to your resume that will make them remember you or make them take a second look at you. So, for example, you can join poster presentation to show them, you have some interest, academically and all that. And yes, you can do some publications. So publications, you can, yes, of course, you can do a case write-up on one case, especially if it's rare. But if you don't have a lot of rare cases, you can do write-ups on, let's say, your hospital's experience post-tonsillectomy bleed, for example. You can say that, like, post-tonsillectomy bleeds for the past 10 year experience. And then because maybe in your hospital and in this region, Southeast Asia and all that, you can kind of state, and then maybe you can find some similarities in the reason why patient had the post-tonsillectomy bleed, for example. Okay. Or a 10-year retrospective review, or outcomes of whatever, outcomes of whatever surgery that you've done for in your hospital. So let's say you want to say outcomes of laryngoplasty in your hospital for the past 5 years. So you can do that. You can get all that data from your hospital. Okay. And it's good if you have initiative. So because every candidate that they see, it might look the same to them. And every year candidates increase. And the number of candidates that they are accepting doesn't increase. So, for example, you have a lot of OSA patients, you have a lot of obese patients, so why not, for example, you can just create a support group, so give them some motivation to lose weight. And also, you can, before I said, search for operative kick. So that shows that you have initiative and you want to learn and you want to operate. Okay. And doing all this in the program, you can't do it alone. So you need to, it's good to have a study group, a lot of friends and support as well. And you can't read everything in one day, so that's unrealistic. So set realistic goals and you just read. If you're not in the program yet, it's good, just read whatever cases that are in the ward. So read around that, because that would help you manage the cases daily as well, and it will help you remember. And you practice your surgical, so just keep practicing. Like anything is good, even if it's lumps and bumps, tracheostomy, it's okay. If you've done 10, if you've done 50 is better than 10. So just keep doing it. And you can learn from management plans from your ward rounds. So if you have a case and then you just see, okay, why did the surgeon order that? Why did they do this? Why did they not decide for surgery? Why did they decide for conservative or antibiotics or things like that? So you can notice all those small decisions that is made daily in the rounds. And then we have dissection courses, right, in every state. A lot of places host dissection courses. So I would try to go for that, because if you think like, I'll go for that when I'm a specialist, but the prices go up when you're a specialist, so it's better to go as a medical officer. And I know it's pricey, but I would advise before you finish the program to attend every dissection course twice. And I know it's pricey because each dissection course is like 1,000 ringgit plus, but it's really, really worth it, because it's better to practice everything on cadaver before you do it on a real patient. And you can also, there's a lot of, if you Rajin, you can Google, there's a lot of overseas courses that have scholarships. So some people even offer, like for young surgeons, they even put their criteria less than 30 years old or less than 25 years old, and they're willing to sponsor you. So it's worth it to every now and again just do a search, and you never know what you find, and you never know that there's some scholarships that you can apply for and you might get it. So that's good to have. Next. Next. Okay. So after so everybody is a general ENT at the moment. So after that, you can do a subspecialty. I won't touch too much on that, but these are the subspecialty that is offered in the government: head and neck surgery, otology, skull-based surgery, pediatric ENT, and also rhinology. And next. So the application for the subspecialty training is the same website, which is HLP. And the criteria is you need minimum of 2 years experience after the date of gazettement. And yes, so they do give access extra point people who have history of working in pedalaman areas like rural areas or Borneo as well. And you need support from your department head. They will request a referral, like a recommendation letter. It's a 3-year program in Malaysia under KKM, 2 years within Malaysia. So they will shuffle you around different KKM hospitals that offer that subspecialty to attach to those consultants. And also, you can also attach to university hospitals as well. And 1 year is abroad. Next. Okay, that's it. Thanks.
Okay, thank you. Yes, thank you, Ms. Intan, for the very quite good and very useful presentation for us. But I'm gonna add up some point, I think. So previously I'm MO surgical for about one year and a half. So I'm gonna touch about the MRCS part. So basically for the general surgery, for the MRCS part, it's take about 4 points for the master program in surgical. By speaking to Prof. Salina, which is currently head of department UKM, so she said in ENT, you got MRCS, even you pass or not, even you pass, that one considered as a 1 point. So that's why it's gonna not very benefit to you lah. But so you're gonna take some good point during the interview lah. Maybe also maybe during a viva.
Yeah. If there's a lot of candidates, 1 point is important.
Yeah. I think it's also a good opportunity for you to actually start studying and revising, because it's going to be roughly the same scope as the entrance exam or the MEDEX later on as well. So at least it keeps you motivated to actually study for the exams, regardless of the entrance exams. So I mean, on top of that, it's still a point. So
but who's one we're taking and pass is really have some higher point lah to get be chosen for the candidate for the master program.
Yeah.
So then I just want to ask one question about the case write up. Is it the case write up during MO ship is can carry forward during the master program, or is it the case write up during master program is totally different? We can mix up the two things.
You can carry it forward. You just can't carry forward the publication date. So if it's already done before you enter the program, then it doesn't count. But if you haven't sent it for publication and you sent it during the program, okay.
During the master program, then it's count.
Yes. Meaning you can write a few and keep it, or you can write, or you just say you haven't had time and you haven't sent it in sent it in during your program, then it counts.
Oh, okay. So I think we can, if we have this, we can bring some to the master program lah. I mean, if we got some.
Yeah.
All right. So I think that's thank you very much for Mr. Tan. That's, I think, for the audience, that is the view, the perspective from Mr. Tan, which is from the KKM side. So now we're gonna moving forward to Mr. Nick Muhammad Azli bin Nick Hussein for the selection of master program from the Kementerian Pelajaran Malaysia lah, from the KPM side.
Okay.
So Mr. Nick, the floor is yours.
Thank you. Assalamualaikum and good evening, everybody. Okay, firstly, I'd like to thank Ms. Intan for a very in-depth and comprehensive presentation. I think she covered practically everything that actually everybody who wants to join a master's program or wants to train in to be a specialist in ENT surgeon in Malaysia, she's covered. So I think I'm just basically what I'm going to add on is the perspective, or what are the opportunities or career pathways that you can take in institutes of higher learning in Malaysia for a career in ENT. Okay. So I'm with the ENT department in the Faculty of Medicine in UiTM. So I mainly practice in the Sungai Buloh campus of UiTM. That's where we have our specialist medical center at the moment. We're still waiting for our main hospital in Puncak Alam to be ready, inshallah, in the first half of next year. But I also provide clinical services in Hospital Sungai Buloh prior to the COVID pandemic, unfortunately. So at the moment, because most of the services are ceased there in terms of ENT. Okay, next slide, please. Right, so the pathways, there essentially, there's a few points of entry into a career in ENT in the universities. So usually if you were to start as an MO, you can join as, basically there's two main pathways or two main tracks, which is as an academic track or a clinical track, okay? So if you join as an academic track as an MO, so you join as a trainee lecturer, meaning that you normally would have been at least a medical officer for a year or two before you apply to become a trainee lecturer in one of the departments and the faculties. And essentially, your main role would be, apart from providing clinical services as a medical officer, you'll also be geared towards joining a master's program. Okay, so most of what you will be doing to prepare for it will be towards joining a master's program. And usually we don't expect our trainees to actually undertake any teaching obligations. Okay, so once they enter the master's program, essentially they are out of our service, so they don't provide any clinical service or academic service to the university or department that they are from. Okay, so usually, like from in my time, we had the option of joining either of the three universities, because at the moment UiTM don't have a master's program yet, so our training was outsourced to other universities' master's programs. Okay, so so upon completion of your master's program, you then return to UiTM, and you will be promoted to a lecturer, okay, as a status as a lecturer and a specialist, clinical specialist. This is after you've completed a 6 months gazettement period, which is the same as in KKM. And depending on how big your center is, so let's say if you were in one of the bigger university hospitals like UKM, they can actually gazette their own specialists. However, in the smaller universities where we don't have enough case mixers, or so we tend to go to provide service in KKM hospitals, and we also get gazetted by the KKM hospital. So like myself, I was gazetted in Hospital Sungai Buloh. Okay, so so you have two roles, basically. You have two hats to put on. So your lecturer hat and your specialist hat. Okay, so you'll be doing both in roles. So there, and on the other side, there's also the non-academic posts. So these are, you can either join as a clinical specialist. So usually they are appointed by the university hospitals or universities which have a hospital, and rather than the faculty itself. Okay, so there's the slight discrepancy in terms of the obligations, the work job description and obligations that they have. So they tend not to have as many academic obligations, and that this is also reflected in their KPIs. So they will not have, for instance, publication KPIs or research KPIs, for instance, and they mainly concentrate on clinical services. Okay, and the same with those who join at the medical officer level. So they're clinical medical officers, and therefore they are non-trainees at this stage. Okay, and again, they're also hospital appointments rather than faculty appointments, and there is the option or opportunity for them to later on to undertake specialty training as well. So they will actually be sent off to be trained under one of the master's programs as well, and eventually come back as a clinical specialist. So those are the two main tracks, and at the different levels that you can actually enter. For clinical specialists or lecturers, there's also an option that you can join as a specialist, meaning that you are appointed directly as a lecturer if you take the academic post, or you join directly as a clinical specialist. And these tend to be people who are qualified specialists. So normally, by and large, they are KKM specialists who either want to join as who have are particularly keen in academia, and they join as lecturers, or those who, for whatever reason, most commonly is they want to settle down. let's say if logistics or for family reasons that they want to relocate to somewhere that's more convenient or more suitable for their family life, so they will join as a clinical specialist if they don't desire to have any academic obligations in their job description. Okay, so those are the options for at different levels. Okay, so in terms of the academic posts, so what is expected of you? So as I mentioned, obviously we are first and foremost, we're clinicians, so we have to provide a clinical service of some sort, and being ENT surgeons, we would have to provide a clinical clinical services in ENT. So it's business as usual. So we do the usual on calls, OT lists, clinics, ward rounds to manage our inpatients, and for instance, like for myself and for a few other universities such as UPM, where we split our time in terms of clinical services between our own clinical services as well as KKM hospitals. So can tend to get quite stretched sometimes. Okay, but it keeps it interesting, especially to still do work on the KKM side, because there's tends to be the caseloads are more, so you see a lot more patients, you get to operate more, and also there's a greater variety of case mixes as well. Okay, you also expected to be a teacher. Okay, so obviously you're a lecturer or a teacher, and depending on which university you're in, you are expected to teach at both undergraduate and postgraduate levels. Postgraduate levels, you don't necessarily have to teach in the specialty. For instance, in my department, we don't have a master's program yet, but we still teach postgraduate level for other programs. For instance, for instance, in the family medicine master's program that our faculty runs. So we take
outside of our ENT topic, outside of the
no. We train them. Yeah, they're non-ENT. They're FMS trainees or master students that we actually take on for their ENT attachments, and we do some teaching sessions as well for them. And recently, also we started taking some dental specialties, such as the dental for special needs. They have had some involvement with this as well, with some attachments in our clinics. So that's the teaching aspects of things. We also expected to do research, which is part of our KPI. So we have to do some. We have to have depending on what level you are. So the higher you go up the pyramid, meaning the higher your grade, your rank. If you're, for instance, if you're a prof with as opposed to a lecturer, a senior lecturer or a junior lecturer, you have more KPIs. So you have to bring in more publications for the university. You have to bring in more research grants. So it depends on the level that you're at. Okay, and also research and audit. Audit is also part of the so-called scientific work that we do, because it's all to improve clinical care as one of the reasons for doing all this. Okay, so what do you need to do this? As you can tell, there are a lot more obligations that you would have to undertake. So you have to have a lot more roles as a lecturer and a specialist. Okay, so I think it takes a lot of passion to teach. Okay, I think because you don't just teach things from the book to students, you also try and inspire students at all levels. Okay, so I think students tend to learn better from passionate people. That's my personal experience anyway. Okay, so you have to be enthusiastic and passionate about the topic that you're teaching. Also, you do tend to have to be inquisitive.
Sorry to interrupt. We got one question. So the question is how to redo a master if a person is already failed master oral. Is it possible? So, but he's not saying how many times that just failed master.
It's not
if I'm not mistaken.
If you've already applied for a HLP and you've received it, you've received the hadiah, right? And you didn't make it, it's not possible to receive a second one for the same or a different specialty.
So this one also found about the 7 years maximum, right? About
Sorry?
what Miss Intan said about earlier about the maximum time for the
7
master
years.
program, the 7 years.
Yes.
And also
So
the
I mean,
maximum attempts for your part 1, for instance.
part one, yeah. Oh,
Yeah.
okay. All right.
So, for example, if you've taken the part one, taken it 4 times, so that would determine how many times you're allowed to take the part 2. Because as I said, the limit is still 7 years. So if you reach that 7 years and it's only 1 attempt for part 2, then that's the maximum.
Oh.
Yeah.
So it's gonna make really extended. Yeah.
Yeah, it's possible to appeal. Maybe you can appeal once, but I think that's about it.
Okay. Next slide, please. Okay. In terms of further training, as Ms. Intan mentioned about subspecialty training, in universities there's a bit of a broader scope for further training. So once you're a specialist or a lecturer, you can pursue your subspecialty training. Universities tend not to be as rigid in terms of your subspecialty training, mainly because most departments and most universities are quite small, so we can't tend to send people off for 3-4 years to do their subspecialty training. So there's an option for people to break up their subspecialty training. So you can go for like 6 months postings or 6 months fellowships and come back and then go out again. So it's a bit more flexible in that sense for the subspecialty training. As long as the main thing is what they say is to get peer recognition. Okay, so as long as you're recognized within the subspecialist circle as being able to provide that subspecialty service. Okay. Also, you can also pursue other further trainings that are more academic and more research based. So you can proceed with doing a PhD, which can be done part time, or other kind of academic or research qualifications such as MPhils, which are Master in Philosophy, or medical doctorate, which is the UK version of a PhD for medical doctors, and Masters in Science. Or you can even go for research fellowships where you go for 3 to 6 months or sometimes up to a year in a center where you can basically get a lot of research, get involved with a lot of research projects in other centers which are actively doing research. And because they may have more access to more grants, for instance. Also, we're allowed to go off on research sabbaticals. Basically, that's you take like a period of time where you just concentrate on doing your research. It can be locally or abroad, but it tends to be you have to have some sort of target by the end of your research sabbatical. Let's say you have to be able to generate a certain number of papers by the end of it. So these are the options for what we can do to actually further our training once we are specialists or lecturers in universities. So it's not just subspecial training, but obviously if you want to go for more of a research based furthering of your training, then you can do that as well. So that's an option. Next slide, please. Okay, so these are a few of the FAQs that I was given by the host of this webinar. So why did I choose ENT? The first thing that really struck me when, as a student, it was I still remember when I was a student doing an elective in my final year. It was just the breadth of the surgical skills that are involved in ENT. Okay, so you can go from a big neck dissection, which is very gross anatomy and very just right in front of you, as opposed to and then you can go to another OT where they're doing a microsurgery for a mastoid, for instance, to endoscopic surgery. So it's just it just amazed me like how going from one OT to another, there was such a varied surgical skills involved in the practice of ENT. Plus also ENT, it's a nice mix of a nice balance of a practice of medicine as well as surgery. You know, it's and it's one of those things where it's a very niche specialty where if you don't really know enough about it, you might think that there's not much to it, but actually there's ENT that, I mean, there's a reason why there's so many subspecialties in ENT, because there's so much depth to it as well. Okay, next slide, please. So the program structure, actually, that's definitely been covered in depth with by Ms. Intan. In terms of tips to success, so time management is very important. Okay, especially once you're on the program, one of the common feelings that you will have is that you're always chasing time. Okay, it feels like you never have enough time for anything. But it's all down to time management. Okay, so if you can manage your time properly, you can you'll have time. I mean, most people who are in masters or are doing masters or have been in masters, do it with families in tow. So it is possible. And obviously, that in mind, you have to have a supportive family. Of course, that's very important as well, and understanding family, that will be of great help. Okay. Also, this applies to at any stage. If you're in the program, or you're not in the program, always prepare well for the OT sessions. Okay, because there's nothing worse than that you can. There's no bigger sin that you can do than to go into OT and not know what the surgery is about, what the anatomy associated with this or related to the surgery is about. You'll be wasting your time. You'll be wasting the surgeon's time, because you won't know you won't be able to anticipate what the next step is. You won't be able to help or assist the surgeon adequately. So yeah, do your background reading before you go into OT. It will be a lot more beneficial for yourself as well. Okay, I mean, especially now with there being so many resources out there. I mean, the internet nowadays is you can get everything off the internet. So you can get all your reading done from there. You can get your access to surgical atlases and YouTube videos, surgical videos on YouTube. There is a great resource. So don't let that go to waste. Okay, and therefore make your OT session go to waste as well. As Ms. Intan mentioned before as well, do reading around the cases that you see in the wards as well. So if you see any interesting cases in clinic or in the wards, make sure you read around it, because there's no better teacher that you will find than the patients themselves. Okay, so in terms of the history, the examination findings, and how you tally that and tie that in with what you read in the books, the theory and everything else will make more sense when you read and associate it with a case. Okay, it tends to consolidate your knowledge better, and especially ENT is very important to actually associate what you see with what you interpret your clinical judgment and your analysis of the case, because a lot of spot diagnosis in ENT. Okay, so make sure you see what you see, you recognize, and compare to what the typical clinical picture is as well, and see if there's any variations from the typical presentation, for instance. Then try and figure out why. Okay, always be curious about the cases that you see. Okay, and adequate preparation for your master's admission interview. I think Ms. Intan has been through in depth as well. So the logbook, adequate. You need to make sure that you study enough for your entrance exams, and just make yourself presentable. Okay, not just the appearance. I mean, everything. How you appear on paper as well as in person when you actually get interviewed. Because you have to remember that interviews, other than the points that you want to show or that you can accrue, you also want to one of the things that they say is your perwatakan. Okay, that's one of the things that they actually will look at. So if you can come across as someone who's enthusiastic, someone who's keen to learn and serious about pursuing this as a career, then inshallah you will be successful in the interviews. Okay, I guess admin track, same. Ms. Intan's covered that. Career opportunities and job prospects. Okay, I think that essentially if you are to be a government ENT specialist, there's, other than KKM and universities, the third possibility is in the army. Okay, so if you're an army, that's the other track lah. But I can't really speak much to that. So those are the three options if you were to be a government ENT specialist. Obviously, there's other options in the private sector. Like you can join the private practices, private hospitals, and even private universities have job opportunities for ENT surgeons. Okay. Next slide. Okay. Sorry. Yeah, time management is key. Yeah, so this was me in my master's, and I mean, I think I was when I gazetting, so I was constantly catching up on sleep. Yeah, so I like to end my talk on that light note. Thank you very much. Any questions or anything else?
The record is wrong. How soon? Okay, we got a question from Nur Hanis Sajwani Roslan.
Okay.
How soon can we want pursue subjective in MOH or academia?
Right. I think Miss Intan had covered that. One of the criteria is 2 years after date of gazettement, right, Intan?
Yes. 2 years, especially after date of gazettement. That's how soon you can apply. But also, everything is competitive. So because there will also be an interview, similar, something like without the entrance interview for subspecialty as well. And obviously, they will consider all candidates. But yeah, that's how you can apply.
Yeah. Sorry. I think one of the things that they want to make sure that you are a good enough generalist. That's the key thing. Before you can be a subspecialty, they want to make sure that you are have enough experience and a good enough generalist before they would consider you as to pursue a subspecialty training. In university, there's no set limit to it, but it all depends on where you intend to actually pursue your subspecialty training. So most programs, like fellowships, either locally or abroad, will require at least 3 years, if I'm not mistaken. Yeah, like for instance, the fellowship programs in UKM, you need at least a minimum of 3 years experience as a specialist before you are considered qualified to be able to apply for them. But obviously, you can check most there's a lot of fellowship out there.
We got another question came up, so we probably know has
right. Okay.
So any program in Malaysia?
Yeah. Okay. There's been a lot of discussion about this and planning regarding the parallel program. At the moment, there still isn't a set decision yet as to when, or even a date when they're going to roll out this parallel program yet. But it's in the works as far as I'm aware. Basically, this just a bit of information about the parallel program. Essentially, it's another way that an initiative by the Ministry of Health to provide training, alternative pathway for people to train to become specialists. And the way that it works is that they utilize the external exams, meaning they utilize the FRCS and the MRCS, so the Royal College of Surgeons of England.
Mr. But this one has been already implemented or just already ongoing on in Malaysia for that process? But
not for ENT. They have had. I think they've rolled out for other specialties, but ENT, I don't think they've rolled it out yet. No. Yeah. But essentially, it uses the FRCS and MRCS exams for the actual examination part. But you still have to be in like a recognized job or recognized post in the KKM hospital.
Yeah. So can they pay and redo the master ORL program or parallel program? I mean, they pay maybe they pay by the candidate first and then claim back about the scholarship.
Come back as a private candidate, maybe, because the only one that you cannot is to get a second HLP.
Yeah.
So maybe as a private candidate.
Mm-hmm. That one is I think it'll be down to the university to actually decide on taking private candidates, but they do have the option for taking privately funded candidates. Yeah.
This one for the do you both further studies concurrently? Any tips for the young doctor couples who are both choosing postgrad study? Because we got one viewer here, so they really want to know the golden tips for them.
We were fortunate enough that our master's program was sort of staggered, meaning that I was already in the program. I was in I was already in my final year, and Miss Intan was in her first year at that time.
We overlapped for a short while, but
yeah, so that was very helpful in terms of because once I've completed my masters, so I was be able to basically Miss Intan was able to take on or dedicate her more of a time to the completing her masters lah. I think when it comes
it's
to
possible but difficult,
yeah,
but not impossible, because we have a lot of friends who husband and wife are in the program for different specialties, so it takes a lot of understanding, but it's not impossible. It's possible.
Yeah, especially with a supportive extended family.
Yes.
Yeah, that's
kids.
very important.
With kids, yeah, especially, yes.
Okay.
Oh, okay, no, this one. So I think we already reached to the end of our webinar program.
Okay.
So for the folks, is there any question? I think no question for the moment. So I think thank you. I think I think it's totally covered for both of you, from the KKM side and then for the KPM side, especially for the KPM side, because I not really know about how about the UITM program, how about the USM program, for the KPM side. So I think it's gonna help to our candidate, to those interested, maybe to the housemanship, to the medical student, and hopefully they can contact us through this organization, which is Heart Health Empowerment and Reform Team. And then I think one of the, if got any other question, they can email you directly, right?
Yeah, sure. No problem.
Okay, I think that's all. Thank you for your time, Mr. Nick Hazri and Ms. Intan.
Thank you very much. Thank you very much, everybody, for joining us.
Thanks for having us.
Hope it was useful.
Thank you for having me as well. And thanks to the Heart program, to the host. Thank you very much. I think the program is really smooth for us.
Yeah. Thank you, everybody.
Okay. Thank you.
Okay. Bye.
All right. Okay. Assalamualaikum.